Associate Professor in the section of Allergy and Immunology at the University of Chicago. I'm also the Clinical Director of the Southside Pediatric Asthma Center. And I'd just like to thank the Chicago Asthma Consortium for having us join today to talk about Ask the Asthma Doc. I'm here with one of our community health worker supervisors at the Southside Pediatric Asthma Center, D'Amica Edwards-Hart. I'll let her introduce herself.
Thank you so much, Dr. Ninehouse. My name is D'Amica Edwards-Hart. I'm the program manager for the Liaisons and Care Community Health Worker Program, which is also a component of the Southside Pediatric Asthma Center. So happy to be here.
Yeah, and D'Amica, you've been you started your career in community health work in asthma, so really excited to have you join today. We did put in the chat or the comments, but we just wanted to make sure that we're going to be talking about how to deal with allergies and asthma during the holidays, as that's upcoming. But just know that some of this information may or may not be relevant to your specific case, because everybody's asthma and allergies are a little bit different. So if you really do have any questions, you always should talk with your asthma doctor or clinician to get the most accurate information for you and your allergies and your asthma. But today we're going to start talking a little bit about triggers. So first of all, I want to ask you, D'Amica, when you see your patients and your clients, like what kind of triggers or allergens should people be aware of, especially during this holiday time?
Absolutely. One of the biggest things we like to educate our patients on right now is the changes in weather. We live in Chicago, where we can often have more than one season in a day. So it's very important to make sure that we are appropriately dressing for those weather changes, and maybe even like if we're one that get hot easily, but make sure we carry a jacket with us just in case we go into some place where it's a little cooler or it gets colder throughout the day. In addition to that, when the weather starts to significantly drop, making sure that you are covering your mouth and your nose to prevent that cold air shock from getting to your lungs and your airways, as that can definitely send you into an asthma attack. When it comes to indoor triggers, we think about things like cooking and being around a lot of our family, which is great, right? But those of us with asthma, I do have asthma myself, we have to take a little more precaution, right? So maybe if you're hosting, maybe we ask our family members to refrain from wearing like a lot of fragrances, such as colognes and perfumes and body sprays, because that could trigger someone that does have asthma. In addition to that, we want to make sure that we are being careful when we're cooking, because smoke of any kind, not just smoke from a cigarette, can cause someone to have asthma symptoms. So we just want to make sure that we are utilizing our ventilation systems within our home to address those immediate concerns. You're muted.
I was just going to say, I really like how you brought up, especially if you're hosting or if you're at other people's houses, but really thinking about those indoor triggers, which can be like the smoke and as you pointed out, we're not necessarily talking about people smoking, but also from the food. But it also does bring up a good point that, especially if you're hosting and there are, people that are coming over that do smoke or vape, that you probably should have those rules set out before that, to let them know if you allow smoking or not in your home, which I'm sure we can definitely talk about, how smoke is a trigger, but I think that's an important thing to talk about too.
Absolutely. So, of course, we have no control over who does and who doesn't smoke, right? But what we can ask guests to do is to smoke outside. And well, D'Amica, what if it's cold outside? Put on what we consider a smoker's jacket. So that is just an article of clothing, something kind of heavy though, that you want to wear outside to smoke only. Once you're done with that, put it in a bag, make sure that it's closed tightly, or put it in like a storage container box, so something like a tote, to make sure that that smell isn't getting out into the air. After that, you want to make sure that if you are the person that's smoking, you come in, take off that smoker's jacket, go in the washroom to wash your hands to get that additional residue from the cigarette off of your hands, because it can, what it's doing is leaving behind that third hand smoke, and that is the residue that is on your hands, that's in your clothing. When someone is done smoking, that can also send someone into having asthma symptoms.
Yeah, yeah. And what about, if I'm going over to my aunt's house and she has a pet that and I'm allergic to, any suggestions on maybe, how to handle that?
Absolutely. So we can ask the aunt if she can, while the event is happening, if she can keep the pet in one room that is away from the guests, and one room that the guests won't have access to. In addition to that, she can steam clean her furniture. She can, make sure that she does a lot of dusting so that she is getting rid of the pet dander, because pet dander is what causes people to have asthma symptoms. So the best thing to do is to keep the animal off of the furniture, at least during the time of the event, and away from the guests.
Yeah. Okay. Yeah. Thank you for that. That's really great information. So, okay. Um, So next one is, sometimes we may be traveling far away to visit family. I know I may be, it's a little bit more than just driving 20 minutes or so. So what precautions like should I take if I'm going to be traveling to make sure that my asthma remains controlled?
One of the most important things, and I really do appreciate this question, is making sure that we are identifying what the temperature would be in that area.
Oh, yeah.
So, again, I'll use Chicago. So, we live in Chicago, so we can expect that in December, in the winter months, we're going to have cold weather, right? But maybe we're going to travel to California, right, or Florida, or someplace warm, even out of the country. We want to make sure that we are being mindful of the weather change, because when you are going from one climate to another, that's an adjustment, right? So it is an adjustment for your body as well. So you want to be mindful, and again, like I said earlier, make sure that you are taking the appropriate clothing for the area that you'll be vacationing in.
Okay. Yeah. Um, and then I know we talked a little bit about some of the holiday triggers, such as weather changes and allergens, but we didn't talk too much about viruses or bacteria, infections that can be a huge trigger for somebody living with asthma. So, do what how do you address that with your patients? Do you talk about vaccines or hand washing, or what are some of the things that you recommend?
Absolutely. We definitely recommend anyone with asthma to make sure that they receive the flu vaccine, including the COVID vaccine as well. It's a little tricky because some people are like not big fans of it, right? Who likes to get a shot? But one thing that I can say is that it does significantly decrease the severity of the flu, or the illness itself, right?
Mhm.
And we know that sometimes when you have a cold or you have a certain type of virus, those symptoms can actually mimic those of asthma, right? So you still have that coughing, you still have that wheezing, the chest tightness, and the shortness of breath. So it's kind of hard to tell which is being impacted at that moment. So in order for us to kind of alleviate that, we often recommend that anyone, again, that has asthma receive the vaccines when it's time to receive them. And also be mindful of your triggers, right? Making sure that you are talking to your doctor, seeing your pulmonologist, so that you are staying on top of your medications as well.
Okay, yeah, no, that's a good suggestion. I was just going to ask, like, when should you see your doctor? Should you see, follow up with them either before you go on your holiday travel, or after, or just again, if there's any specific recommendations there.
I would definitely recommend you see your physician when you are scheduled, right? So what I mean by that is anyone with asthma, oftentimes we have regularly scheduled visits. So my recommendation would be for you to make sure that you attend those appointments as they are scheduled or when they are scheduled.
Mhm.
Now, of course, if you start to have symptoms that you can't get ahead of, right? You're having difficulties getting these symptoms under control, just reach out to your care team, right? Reach out to one of the nurses, send a my chart message if the institution where you receive your care allows for that. Anything you can do to make sure that you are getting an appointment sooner, right, than your scheduled appointment. Especially if you know that you have a cold, and again you are having difficulties like kind of getting those symptoms under control. But aside from that, I would definitely recommend whatever your doctor scheduled is how often you should see them.
Yeah, that's a really good point. Yeah, and I was gonna add too to when you were talking about, trying to prevent colds or other upper respiratory tract infections. Definitely, vaccines are a great way. Hand washing, that's probably one of the best ways. And two, I know a lot of people that feel more comfortable now, especially in larger groups, wearing a mask. So,
Mm-hmm.
if that's something that you feel more comfortable with, whether it be again if you're flying or in airports or just at, a family member's house, if that's something that you are concerned about, then wearing a mask, that I think we've shown that can work.
Mm-hmm.
So that's something to consider, but obviously thinking about what works for you.
Absolutely. Mm-hmm.
Yeah. So um, okay. Um, well, I feel like I've been talking a lot. Do you want to ask me some questions? This has been
Sure.
a great conversation that we're having.
Sure, one second here.
Mhm.
All right. So, my question for you would be what would you consider an emergency plan, right? So, with regard to someone that is heading out of town for a family event for the holiday season, what would you recommend?
Yeah, so I mean, one of the things, first of all, to be prepared. I'm sure you talk to your patients about this, Damika, but is making sure you have your rescue medication with you. Um, one of the community health workers I've worked with, she was like, "You don't leave your phone. You don't go over to somebody's house without your phone. You have to treat your asthma rescue inhaler like your phone."
This is true.
Yeah. So that is what's going to help you. So making sure, as we've been talking about, like anticipating maybe what are some of those potential allergens or triggers that you may get exposed to. And as we're talking about preparing for that, whether it be, okay, I need to bring a mask with me, or I
Mm-hmm.
may need to talk to somebody ahead of time. But definitely having your rescue inhaler. And I think even before that is making sure you're taking, if you're on a controller medication, making sure you're taking your controller medication as prescribed
Mm-hmm.
consistently and as regularly as possible. I think one of the things that we hear too is, or especially around the holidays, is that, oh, I haven't needed to use my rescue inhaler for a while. And then I looked and I don't have any medicine left, or I only had 2 pumps left in it. So making sure before you travel, maybe a week before, that or just in general, if you know you're going to be potentially around, your asthma triggers, making sure you have enough medication, and making sure that you're able to reach out to your clinician to get those refills, and knowing too that around the holidays there are holiday schedules for your doctor too. So if you call them on Christmas Eve, they might not be able to get you the
Sure.
prescription
Mm-hmm.
the next day. So just being aware of some of those things. So I think those are some of the things I think about, like hopefully not getting you to the emergency plan. But I think if you do get to the point where you are having symptoms, I think the thing is, and again, D'Amica, you may be able to help chime in on this. Is first, you don't want to panic.
Yes.
That's one of the things that is you don't want to do. But making sure you take your, use your medication with a spacer if that's what your provider clinician has prescribed for you, and then using that. Um, a lot of my patients have what we call an asthma action plan.
Mm-hmm.
So maybe even taking a picture of that, if it's like on your refrigerator, taking a picture of it so you have it on your phone so you know what to do. If you're going to a party that people don't know you have asthma, it might be a good idea to let one or two people know, just so in case you start having any symptoms that they know what's going on, that they don't think you're choking or anything like that, that they know. But again, I would just say, following your asthma action plan, making sure you have enough of your medication, and those would probably be the biggest things that I would think of. I don't know if you want to add anything, D'Amica.
Oh yeah, sure. Everything you said is definitely what we educate our patients on, and I would like to add that so with the two types of inhalers, right? You have the control and the rescue inhaler. Everyone with asthma may not have a controller, right? And so that is a medication that is given to you, and you to take it every single day, regardless of how you're feeling, right? But everyone with asthma should have a rescue inhaler. Now, it is important to mention that when you are traveling, even though you may not use your rescue inhaler often, like you said earlier, you want to make sure you have it with you. But also, since we often educate our patients, if you're at school or work, you don't have to take your controller with you, right? Because you're just using it in the morning and at night or as prescribed, right? But it is important to mention that when you're traveling, you want to have that with you, right? Even though you may not have had any asthma symptoms in a while, but that controller medication is actually what's keeping your symptoms under control. So just wanted to add that bit.
Yeah, and I just thought about one thing again, depending on what your rescue medication is, if you haven't used it very much for a while, that, and especially if it's in your suitcase jostling around, you may need to do, what we call like a priming, especially if you haven't used it for a while. So that's kind of like, before you're getting ready to use it, that you just need to prime it, like push down on the inhaler and let some of the air go. So that's just another thing to think about.
Absolutely. So I'd
Yeah.
like to talk about stress for a second, Dr. Ninehouse. So the holiday season can be stressful, right? For a number of reasons. Kids are out of school, so that's added stress, right?
Yeah.
Preparing to have family over and even buying gifts can be stressful. How can stress affect asthma, and what strategies would you recommend to manage stress?
Yeah, that's a really great question. And I think just, as you said, the holidays can just be a very, tough time for people. And again, whether you're not hosting or you're hosting. So, we don't, the picture between stress and asthma, we do see some correlation there, but it's not extremely clear because it's always a little bit difficult to, like, what I would say, quantify stress.
Mm-hmm.
Something that stresses me out might not stress you out, Tamika, but we definitely know that stress can promote inflammation, and we know asthma is a disease of inflammation.
Mm-hmm.
So that can be that can be tied. Now, some of the things that you can do to manage stress is especially when if you're getting very overwhelmed, we do have actually shown that breathing exercises can help reduce the stress, as well as in some studies in adults has been shown to improve some asthma symptoms as well. But I definitely think for the stress relief, it is very effective. So other mindfulness practices are things like imagery. So really thinking, okay, where I feel like most my happy place essentially. And
Mm-hmm.
for many, for me, I would say being at the beach or being on the by the water. That's another thing. But sometimes too, just taking a little bit of time for yourself. if things are getting too crazy, again, stepping aside, going into a private room if possible, where you can get some quiet and take some deep breaths in. Those are definitely some ways to manage it. Again, probably sound like a broken record, but I think the biggest thing is, again, getting back to following your asthma action plan. So why don't you take the piece of your asthma meds and all of that out of it, out of the stress, making sure that you're taking your, if you're prescribed a controller, taking that every day, getting your vaccinations if that's warranted for you, as well as, again, making sure that your medications are up to date, they're not expired, all of those things. Those little things are going to help reduce like some stress in case your stress does influence or exacerbate your asthma.
I think that I would agree. I think about like when we host here at my home, right? It can be very stressful, and I find myself stressing out a lot over the smallest things. So I would agree with you, just taking a moment for yourself, and also too, I would add understanding that it is okay, right? You may still be, wrapping things up as guests are starting to come in. It is okay. Breathe, right? People that are coming to your home are people that love you. So I'm sure that anything that your guests can do to relieve some of their stress, they would. And then oftentimes we're overthinking anyway. So I think that if we give ourselves grace and realize that, everything will be okay, it will be. And I think that that'll help as well.
Mhm.
The next thing I like to ask or talk about is indoor air quality, right? So, how can we maintain good indoor air quality during like holiday parties and especially with cooking, right?
Yeah. So I think you brought this up earlier, is really thinking about good ventilation.
Hmm.
So that is one thing. And again, when I say good ventilation, you want to make sure, especially in the kitchen, that you have like a vented hood, but one that is putting the vent outside
Yeah.
or somewhere else. Like I remember one of my apartments in my 20s, it was like, oh, this is great. It has, a fan, but it just blows right back at you.
Hmm.
So just knowing, if you don't have that, then, trying to get some ventilation other ways, like opening up a window, putting a fan, something like that could definitely help get again improve the air quality. The other thing that we think about when we think about air quality is not only ventilation but also filtration. So that is an option, and you can get an air purifier and put it in the room where most of the people are, or in the kitchen even. I know sometimes those can be pricey, so that is sometimes an added cost, but I know, sometimes, you can get, especially maybe around the holidays, maybe you can get things on sale. The other thing too is that there are low cost ways that you can actually make your own air filtration. You may remember this from COVID, but it's called a Corsi Rosenthal box, and you can usually make it for about like $40 if you go to Home Depot with some filters and a box fan and duct tape. So that is an option. It doesn't maybe look as nice and sleek as some of these other air filters, but that's probably the other biggest part. And then I think that is definitely another way to definitely think about air quality are, again, sometimes we always want our house to smell good, but those like plug-ins and with pumpkin spice, or winter green, whatever, those fresheners, those actually aren't really great for your air quality and can really worsen your air quality. So maybe thinking of other options that are a little bit better for the air quality, and that can range from. I know it kind of depends on what works for you, but I know some people have said like soy candles are better than than the regular, wax candles. That's one option. I know some people have used kind of like essential oils. I know
Hmm.
some people that have even just said like, "Oh, I'm just going to put orange peels in some warm water,"
Yes.
and
I was actually going to mention that too. Yep.
yeah, yeah. So you can be like, you could do cinnamon sticks and orange peels or other things like that. So there are ways, if to make your house smell nice, during the holidays, that don't require, a lot of air fresheners and such. So.
I'm happy you mentioned that too because even though I don't like see patients anymore, one of the biggest things that I used to see when I would go into a patient's home for a home visit is, candles everywhere, plug-ins everywhere. And yes, they do smell good, but I think that a lot of people don't know that they are filled with a lot of chemicals that are not good for anyone. So I'm
Mhm.
really happy that you mentioned that. So the last question that I have for you is about dietary concerns.
Mhm.
So we know that there is a connection between allergy and asthma, right? So are there any specific foods that you feel like people should avoid that may trigger their asthma?
Yeah, so as you mentioned, again, if somebody has asthma, they're more likely to have a food allergy than somebody that doesn't have asthma, but that doesn't mean that everybody with asthma has food allergies or vice versa. So definitely, if you either have a concern about a food allergy or have been diagnosed with one, it's really important, especially if you haven't been diagnosed but have a concern, is to see a clinician about that, because if so, you may need to carry an EpiPen with your epinephrine auto injector and strictly avoid those foods. Sometimes with that, you might not require, maybe it might not be an allergy that would lead to an anaphylactic reaction. So, again, making sure that you're talking to your healthcare professional or clinician about these possible allergies. Now, I did want to bring up one thing, because it's just an area of interest that I do research in. Is actually, they have shown that high fat diets, in general, but there was one study that actually showed, if you gave people some, McDonald's to eat, and then they looked at the lung function 1 hour, 2 hours post, that actually they saw worsening lung function, at that time. So
Wow.
definitely, yeah. So definitely, there is some data in the research literature to show that high fat, even like a one time high fat diet, can actually increase inflammation in the lungs, as well as reduce your lung function. So, I'm, again, holidays are a time to, enjoy time with your family, and that often that does include eating. So I'm not saying not to do that, but just something to consider, especially if you're finding, after, especially if you're like maybe hopping from multiple houses, just really being a little bit cautious about that. But otherwise, because if somebody has asthma, I don't necessarily specifically tell them to avoid any foods. But again, for some people, they do see that, again, they either have a food allergy, or some things like alcohol can, worsen their asthma symptoms. So that's just something just to be, mindful of. I also did want to add, to the thing that we were talking about with indoor air quality, because I know we were talking about like fragrances and scents, but
Hmm.
also, I guess, if you're going to have people over at your house, you're probably going to be cleaning.
Yes.
Um, and with that, you may want to say, well, I want everybody to know I've got a really clean house. Then you start using, you're using, maybe considering using stronger, cleaning products, but that can, trigger your asthma. Or anybody else that's coming over and has asthma. So that's just be something to be cautious about. Damika, I don't know if you can recommend, what are some what we call more like green cleaning options instead of using things like pine sol and bleach. Not to pick on pine sol, but
Right. So yeah, of course these things make our home, smell nice, and we're like, oh my God, it's so clean. And I've even been in homes where people are like, well, I don't feel like I'm cleaning properly if I don't use bleach, for example. And I'm like, no. But then at the same time, they're like, but I know bleach is an asthma trigger for me, but I still can't stop using it. So then I will pose the question, have you ever tried vinegar? And almost every single time, I promise you, almost every single time, people are shocked to hear me say that. And I'm like, well, you do realize that vinegar is, one, it's environmentally friendly, and it's better on your body, it's better on your lungs, it's better on your airways, right? And it has the same cleaning effects as bleach. And then also, when I tell people that I have asthma myself and I also use these things, sometimes it helps to make it a little easier for people to understand. And another tip that I like to tell them is, so you can also add, like the fruit fragrances from, you boiling the lemon or the orange peels or even the limes. And that'll also give off like a very nice citrus smell that'll be, throughout your home. And, it'll give off something wonderful for people to, it'll be an added attraction for guests when they come to your home as well.
Yeah, yeah, that's a really great suggestion. And it can be I have some in my bathroom that I use that I actually put a little bit of like lavender essential oils in
Mhm.
just because I like lavender, but like just to give it a little bit of a scent. But um, you know, some people wonder like, oh, isn't it going to smell bad, after you use it? No, like within a couple minutes, like you don't even smell it anymore.
Well,
So
it's the same with bleach, right? Because bleach, bleach has that really, really strong smell. And
Mhm.
even though, you're okay with using it, after a while the smell goes away. It's the exact same with vinegar. And that's exactly what we like to tell our patients.
Yeah, yeah. Okay. Well, I think that's all the questions we had today, and I think we were able to get through, all the things that you may want to consider during the holidays. And we'll be back in 2025 with more Ask the Asthma Doc. But thank you again, Damika, and thank
Of
you to
course.
the Chicago Asthma Consortium for supporting this. Hope everyone has a good evening. Bye bye.
Thank you. Bye.